Hello to you all. This is Raymond. I'm back for the presentation, and this is the third presentation wherein we are going to discuss about the definition, the types, the cause and the symptoms of diabetes. I remind you that we are using different written books and studies and researches that have been carried out with the different doctors. By definition, diabetes, its medical name is diabetes mellitus. It is a Latin term referring to the sweetness of honey found in the urine of diabetics. Diabetes is a chronic metabolic disorder characterized by persistent high levels of glucose in the blood. This is due to the body not producing enough insulin or not using it properly. In both cases, diabetes prevents the body from metabolizing or effectively using carbohydrates in addition to proteins and fats. The body cells need glucose to live. To satisfy this need, we ingest foods that convert to glucose, especially carbohydrates. But glucose cannot enter the cells without the intervention of insulin, a hormone produced in a normal cell of pancreas, or beta cells of the pancreas. For example, when we eat a piece of bread, a loaf of bread, once it is digested, it is converted into glucose. Glucose circulates in the bloodstream to fuel every cell in the body. The presence of glucose stimulates the beta cells of the pancreas to release insulin. The insulin reaches each cell and acts as a key in these receptors to open its doors and let the glucose in. If there is no insulin, or if the cell receptors do not work properly adequately, glucose cannot enter the cells, and the affected person will suffer from a lack of nutrients. The types of diabetes. In non-diabetic people, when insulin attaches to cells, glucose can penetrate through the membrane and be used. This is the normal situation. But when this doesn't happen, the person in question has diabetes. Normally, there are two forms of diabetes. We have type 1 diabetes, also known as insulin independent, because people who suffer from it need insulin. And we have also type 2 diabetes, also known as non-insulin dependent, because in principle, insulin is not required for its treatment. the two types of diabetes, type 1 and type 2, have different causes. For diabetes type 2, it is used to be called juvenile diabetes or infant diabetes. The body of the affected person produces little or no insulin, so glucose cannot enter the cells and be used. There are different causes of type 1 diabetes. In the majority of cases, diabetes is an autoimmune disease. The immune system mistakenly considers the beta cells of the pancreas to be foreign bodies, and therefore attacks and destroys the beta cells of the pancreas. A minority of people, usually of African or Asian origin with type 1 diabetes, do not have an autoimmune phenomena. So when this type 1 diabetes starts, usually type 1 diabetes appears in children and young adults. However, it can occur at any age of people. The weight also of different people, from the newborn to the adult people. Usually the weight is normal or below normal, but obesity is not incompatible with the possibility of having type 1 diabetes. There are different symptoms of the type 1 diabetes people, but the onset of symptoms that appear suddenly, most likely the destruction of the beta cells of the pancreas started months and years before. But as long as the beta cells are not functioning well, or as long as the beta cells are not functioning below 10% of their capacity, symptoms do not appear. To mean that many people may believe that they have no diabetes within their body once while they are suffering it, only because the pancreas is still striving for producing insulin, and under its capacity, they no longer reach the 10% of producing the insulin. So you may be mistaken of saying or believing that you have no diabetes while you have it. So in children and teenagers, it is usually abrupt. Maybe you can just say that, hey, I hadn't seen any symptoms before. So make sure that for children and teenagers, it is abruptly that they suffer from diabetes while there is no any other symptoms before. And these symptoms are accompanied by ketoacidosis. It is an excess of ketone acids within our body. So these acids, you cannot just detect them personally, but if you go to the lab for medicine, modern medicine, conventional medicine, allopathic medicine, these medical officers, they are going to detect whether you have ketone acids which is exceeded or low or normal. So for these children and teenagers who are suffering from diabetes, type 1 diabetes, unless they have general symptoms for the other people, they suffer also the ketoacidosis. For adults, usually sufficient residual function of the pancreas beta cells is maintained, so that the onset of symptoms is more gradual. The symptoms for adults, they are coming slow by slow, little by little. So they are not abrupt comparing with the children and the teenagers. Although there are many genetic accidents that causes the type 1 diabetes, though there are many physiological errors, more than 200 physiological genetic errors, that the main cause of autoimmunity within our body that destroy the beta cells of the pancreas. I assure you that the type 1 diabetes is reversible. You can live and carry out your own normal life. So these beta cells can be restored, and we have many testimonies that had this type 1 diabetes, but now they are living and carry out their normal lives. So please, for the more information, please contact us through WhatsApp, through YouTube, through Twitter, through mobile phone, and we can even be seen near Kimironko car stages in the district of Gasabo, Kigali, Rwanda. I wish you to get healthy.